1 in 17 people in America lives with a serious mental illness, such as schizophrenia, major depression, or bipolar disorder. About 1 in 10 children live with a serious mental disorder. That's according to the National Alliance on Mental Illness. Here with me in the studio is Joan Becker, a mother who is all too familiar with the struggles facing families dealing with mental illness. Joan is the mother of Mark Becker. On June 24, 2009, tragedy struck when Mark murdered longtime Appleton-Parkersburg football coach Ed Thomas. Mark was diagnosed with paranoid schizophrenia. Joan, now a mental health advocate, is here to discuss access to mental health in the state of Iowa and share her experience with our state's mental health care system. Thanks so much for coming in today.
Thank you.
In recent news, Governor Branstad proposed he wants to close 2 of the 4 mental institutes we have here in Iowa, one located in Mount Pleasant and one in Clarinda. What are your thoughts on this, and how is this going to impact the surrounding communities?
Well, one of my biggest concerns is it's one thing to close facilities and make the promise that you're going to add additional beds to some of the community-based other facilities that exist. What has happened quite a bit, though, in Governor Branstad's realm is things are promised and never followed through. And this is what's been happening with the mental health funding as well. The equalization monies were supposed to be given back to the counties to help balance that shortfall, but it never happened. And so these are some very serious concerns. And it reminds me of back in the 70s when they did the deinstitutionalized all of these individuals because they said they should have the rights to go and live on their own. We ended up with so many homeless people and people who just fell off the charts because they couldn't get services. And that is one of my biggest concerns is where are these people going to go? And do they have to now travel to northeast or northwest Iowa to get those services? Where are they going to go to get help?
Mm-hmm. It was said that remaining patients would be treated at the other institutes or facilities such as university hospitals in Iowa City, but do you think that this is enough?
Well, we're 47th in the 47th in the nation, the lowest percentile as far as for the population and us having enough beds, enough psychiatrists, psychologists. We are so low in the charts. So what is that? They're not going to be able to have enough beds because we don't have enough personnel to take care of those beds for the people. It's not good.
Mm-hmm. The governor says high costs and difficulty finding mental health professionals are the reasons for wanting to close the facilities. But should cost even be a factor, and should there be a price on getting the people the help that they need?
Well, you're asking a mother that, how do you put a cost on a person's life? How do you put a price on that? Unless you've lived it, I don't think people understand. You can't place limits on this. Yes, we don't have enough psychiatrists, but if I could see what Governor Branstad really intends to do, but you just hear talk and you don't have facts. So I hate to say too much because if we could see some more beds come in, but I've just been too disappointed in the past by promises that were always broken.
If you could say something to Governor Branstad to sway him away from this, what would you say?
I would say you go look in the faces and sit down and talk face to face with these families and these individuals that do need help. I read in one of the interviews or the articles about this whole situation that one of his reasons were, well, there's such short stays that they're really not needed because of the length of stay. Well, that's part of the broken mental health system we live with. They're not long enough stays for people that have severe psychosis like my son had. And so that's part of the piece that has to get fixed on the federal side. And Senator Murphy is working on, Representative Murphy is working on getting some changes made so that longer stays for individuals with these very severe illnesses such as paranoid schizophrenia can be there long enough to be properly diagnosed, get them started on a treatment plan, and they can start to see the results of that treatment plan, and then they can become very productive and live in our society. But right now, we have nothing in place to actually make sure somebody can get a long enough stay.
Have you considered lobbying for legislators such as that?
I have I did contact a lot of the representatives, the legislative body, just earlier this week, and I heard a response back from one of them. And so and I put the invitation out that I would be happy to come and share firsthand what a family goes through, because they do not understand it unless they've lived it.
Well, going off of that, why is mental health care so important for not just the person, but also the person's family?
Exactly. You're suffering, you're trying as a family to, why can't we take our son or daughter into the doctor and get them a diagnosis and get them treatment? A brain illness is not different than a heart or a kidney or diabetes or any of our cancer. As one lady said in an article I read recently, it's for some reason mental illness isn't a casserole illness, because if it was any other illness of that severity, you'd have people coming and pouring to you and offering support. It's a very lonely illness for the individual and for the families. Those individuals are fighting forces way bigger than they are. They can't understand why am I going through this? It's just such a confusing thing. And then as a family, you're trying to help them. It's too much. It's just too much.
What's a mother's perspective on this?
You can't kiss it and make it better. There just aren't answers. And you can talk and talk and talk, and I try and encourage and I try and speak up and speak out, but there's a lot of lonely moms and dads out there trying to deal with trying to find their loved one help. And it's so discouraging when this door keeps getting slammed in your face.
So let's just take a step back here to your situation. As I was researching your advocacy regarding mental health and well-being, the words treatment before tragedy really jumped out at me. So tell me about how mental illness affected your family specifically. Like, when did you notice a change in Mark?
We started noticing changes in Mark even when he was 16 years old. Started seeing some personality changes. He made some lifestyle choices that attributed to that. But what my core question still is today, well, I sort of know it now, but my core question then was, but why? What's going on in that mind of yours? But when he got to college, it really accelerated. That's when things really started to accelerate, and he just struggled for several years before it got to the point that he started having severe psychotic episodes in our home constantly, just over that 9-month span, at the last 9 months before the tragedy. It was just, it was so wearying because we didn't sleep. We didn't ever know what state he was going to be in. And he was trying so hard. He tried so hard, but yet he didn't understand. And with an illness like that, it's just so erratic, so it's very difficult to deal with that for everybody involved.
So what steps were taken to help Mark with this?
We had him, he was actually committed twice to a hospital up in north central Iowa, and there was a third committal at the very end. But what our biggest frustration is after the first committal is trying to find someone that we could talk to as parents and say, what is our role in this treatment? What can we do to help? But because he was over 18 and because of HIPAA, that's the excuse they use, they wouldn't discuss it with us. So we didn't know, are we supposed to be trying to make sure he takes his medication? He had a prescription, I don't know what it was, but he didn't want to take it because he didn't think he was sick. So then again, going to counseling sessions. We drove him to many of those counseling sessions and sat in the car just to make sure he would get to those. But what do you get done, or what do you get accomplished in a 12 to 15-minute counseling session? And that's one of the biggest problems, I think, even with the system that is in place. It's not long enough time for you to actually get down to the bottom of what's going on with these individuals. by any means. So we tried, you know, those methods, but we couldn't get a diagnosis. We couldn't, he was scheduled to go see a psychiatrist in July of 2009. He never made that appointment because of the tragedy coming first.
So as you reflect on the months or years before the tragic event, what in your opinion was missing, and how did Mark struggle for years without ever receiving a diagnosis that he needed help?
Okay, so the biggest thing that I can see, there's no communication between providers, between the courts that court order for him to go and see counselors. There's no accountability, and there is no treatment plan in a holistic treatment plan that includes all aspects, the social aspects, the educational, the spiritual, the doctors that are involved, the law enforcement that are involved. I did a presentation for a group, and when I went through all of my journals and my notes, I made a wheel, a communication wheel, and it was all, everything's disjointed. Nobody talked to each other. And his final hospital stay was because was at a different hospital. My ignorance, I thought that they would have been informed of all of the prior years of issues that Mark had been going through. No, because they weren't part of that network. And the reason he had to go to that hospital is because there were no beds in the hospital he had been in before. Mm-hmm. So lack of communication, lack of accountability, and I know they've taken great strides to try and pull that together, but they've got a long ways to go yet.
You said in recent interviews or past interviews that Ed Thomas was the victim of a victim. What can you say about that?
Well, Mark was a victim of the lack of a mental health system in place, and thus resulted another victim that affected thousands of people. And it didn't have to be that way. It didn't have to happen.
Mm-hmm. Mark was formally diagnosed with paranoid schizophrenia after the murder conviction. In your opinion, what took so long for him to get accurately diagnosed, and do you think that this tragedy could have been prevented?
The thing that was standing in the way of Mark being accurately diagnosed is no one taking enough time to sit down and just spend time with him. He is one of the few percentage individuals with mental illness that needs to be in a contained environment for a long enough period for someone to visually work and communicate with him and actually get to a diagnosis. But that doesn't happen, and that's not allowed with our current laws. So that was one of the biggest things. But the other thing is, when he was at that last hospital, we understood that was going to be a 7-day committal. He never should have been released after 2 days or 3 days or whatever it was, because he told a nurse he wanted to leave. That shouldn't have happened. I'm not saying it would have prevented something happening, but I'm just saying I think that there were a lot of places where Mark fell through the cracks, and they're trying to close those gaps in the system. There's many people in the professional system that recognize that, and they're working their way trying to not let that happen again. Mm-hmm.
So was there a certain event, or what kind of made you want to speak out on this important issue in society?
Well, when we were going through the trial, that was a really very difficult time for us, because there was so much that we knew that wasn't being presented. And so it was really hard for us, and one of the things that I needed to work through personally, it was one of my ways of therapy, is to be able to speak out. I wanted facts represented. I didn't want just assumptions being made. I was in the unique position, I could speak loud and clear about how the broken mental health system let our son and our family and the Thomas family down. And so I can either choose to sit back and wallow in my self-pity and feel sorry for myself, or I can choose to stand up and speak on behalf of others and hope that this can be prevented for other people.
Mm-hmm. Is Mark supportive of you speaking out?
Mark is very supportive. There are times that he goes through with his illness. He maybe doesn't quite understand as much, but He's very good right now, but he knows I've written a book, and he knows that I speak out, and he thanks me for that. And he says there's a lot of people that come to him and talk to him about me speaking out, and they say, tell your mom to keep doing it.
Mm-hmm. So where is Mark now?
He is still at the Iowa Medical and Classification Center in Coralville, mm-hmm. and doing very well there, getting very good treatment. And he reads a lot, he plays guitar, he does art. He's very, very gifted, very smart young man, and so he's doing really well right now. Mm-hmm. Yeah.
You mentioned a book. What's the title and when is the release date?
Well, I wish I knew the title. That's going to be determined next week, but it is going to be coming out in April. I'm thinking early April, and it will be available out on Amazon and then on my publisher's website, and at my website I'll have links to where people can get it.
Okay. And what advice do you have for individuals and families that are suffering with this mental illness?
The advice I would give them is, number one, don't take no for an answer. Be persistent in getting care for your individual. They might have to go back and back and back, but get connected. Get connected with other individuals and families going through mental illness. NAMI is one of the best organizations that they could get connected with. I never knew about NAMI. And Dave and I were begging for a resource like that, and no one pointed us to NAMI. And that would have been so helpful to us, because you just don't know when you're by yourself. Am I doing the right thing? What should I be doing? So NAMI I would suggest get in touch with NAMI, and don't quit knocking on doors until you get the answers and the service and the treatment your loved one needs.
And can you explain what NAMI is for those who don't know?
National Alliance for Mental Illness. It's a national organization. They have family support programs that help teach you about the illness your loved one has. They have peer support programs that individuals that have the illness can get together with other individuals with illness, and they can connect. And it's good for both the one that has the brain illness and for the family members as well. Yes.
Okay. Well, thank you so much for being here today. We really appreciate it.
Thank you very, very much. It's been a pleasure.